Welcome to America's Heroes Group.
And welcome to America's Heroes Group. And this week we have the Roundtable with our partner, Jesse Brown, VA Works. April is Sexual Assault and Autism Awareness Month. Today is Saturday, April 9th, 2022. You just heard the governor of talk radio, Kelley. I'm the co-host, Sean Claiborne. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And today we have a serious topic we want to talk about. We're going to hear a lot about military sexual trauma. We have a panelist on our show today, and that's Dr. Koucky, a clinical psychologist in the PTSD clinic and serves as a military sexual trauma coordinator for the Jesse Brown VA. So how you doing, Eileen? You lost your audio. You got to get you on their audio. Try that again. There we go. We got you.
Hi, I'm doing well. Thanks very much. How are you today?
Doing very good. Very good. I was able to find you on YouTube. And also, as by the way, people that are listening, make sure you stream us live on Facebook, because also we are on Facebook. We're on platforms like YouTube, and you can leave comments on Facebook Live and ask questions, and we'll do our best to get to your questions, and I'll still respond to things that are concerns to you. This is a very serious topic, and a lot of people may want to hear about this. So we're going to talk about something very, very sensitive. Now, you are a clinical psychologist in the PTSD clinic. You're a military sexual assault coordinator at Jesse Brown VA. You have 13 years of experience in the field treating psychological and trauma, particularly PTSD and MST. When we talk about PTSD, it's a nomenclature. In the military, we have nomenclatures. We have names we put on things. So in the civilians, we know the words rape, sexual assault. However, in service members and veterans, we know, or we kind of have the idea of MST, military sexual trauma. What is the difference?
There isn't a difference, and I would say that the term military sexual trauma is something that can be more encompassing, and it is something that has been codified by U.S. code and law to help us understand, what service members might have experienced and who might be eligible for certain resources based upon that. So simply speaking, included in the definition of military sexual trauma is unwanted sexual contact, which could include rape or could include unwanted contact of, just other types. But it also includes verbal sexual harassment that occurred during somebody's time of military service. So as you can see, that definition is quite broad and might include a lot of different kinds of experiences that somebody might have during their time of military service.
So the trauma that's involved with that, is that a diagnosis, or is that an event per se?
Yes, good question. It is an event. And what we know with trauma that's experienced by individuals, how people react to that, and what types of symptoms or concerns they might have subsequent to that can really vary. So it is an experience, a definition of an experience, rather than a diagnosis.
Wow. That's interesting, because now I relate to it as like someone hitting you over the head. Like you had blunt force trauma, you have military sexual trauma. So something actually happening to you. So psychologically, what is the process when someone experiences that kind of trauma? What do they go through?
That's a very good question. And I think at the time of an event, people can respond in a number of different ways. So we know that oftentimes what can be common at the time of trauma is the fight or flight or freeze response. And so that's kind of biologically hardwired. That's often how we respond at the time when we are threatened or in danger as humans. And so that can include a lot of different ways that the human or the veteran might respond at the time of an incident. But then subsequent to that, how we respond in the weeks, months, and years after that can really vary greatly. But we do know that the large majority of individuals who experience trauma recover, and that's kind of the most common response is recovery. But we know that there also can be things that continue to cause distress for those individuals quite some time after the event.
Wow, because that's weird. It's eye-opening to me, because when you think of it now as an event, so I'm thinking, well, okay, and also the fight or flight response. So now you're thinking about, okay, with someone, you hear stories from the legal world, and you hear stories especially high-profile cases where someone has a complaint about sexual assault or harassment, a person might say, well, how did you react? And based on the person's response, because it doesn't fit the storytelling narrative of, well, you didn't fight back, you didn't say no, you froze, or you did this, or you did that, then you were somehow, you weren't violated in any way. That your response was inappropriate for, this type of action taken against you. So how do you feel about that? Does that make sense? Do you see that a lot when people tell you their stories?
Well, I think that when we think about survivors of military sexual trauma, we know that how somebody responded at the time of the event, there's a lot of complexity to that and a lot of things that are influencing that. And so how somebody responded is really not of consequence, when it comes to accessing care from MST, in the VA, and how anyone responds at the time is okay and is valid. And so we want to make sure that people know that when they're coming in for care, there is no judgment or, differences or consequences for how they might have responded at the time. We also know that people might not come forward and talk about these experiences for months, years, or even decades, after the fact. I sometimes work with Vietnam combat era veterans who are just disclosing this experience for the first time, in this past year. So I think that there's a lot of just support and encouragement for coming forward if this is a part of your experience, whenever that feels comfortable for the veteran, and knowing that you're going to feel supported at the VA if you seek care, and that you don't need to have any proof or any justification or anything of that sort. We are just here to help as an institution and make sure that you get access to services that are useful.
Now, is it still pervasive in numbers when we say that 1 in 4 women in the military suffer from some kind of sexual harassment, sexual assault? 1 in 100 men, is that still accurate?
Actually, those are our estimates that we are updating all the time with the MST National Support Team. And I should say, as a qualifier, that we know that this is an event that is commonly underreported because of some of those concerns and issues, fear about coming forward. But our best estimates currently indicate that 1 in 3 women veterans and 1 in 50 male veterans report a history of MST.
Okay.
And
sorry,
so I also think it's important to highlight that this is something that's occurred throughout all different service eras, and also happens to male and female veterans. So it doesn't discriminate when it comes to who's been a survivor of it.
So tell us how, because we're halfway through, and I want to make sure people get the information of how they get in contact with the Jesse Brown VA in order to get help, and also what types of things should they prepare for, or we'll get to that question a little bit later. But first, give us how do we get a hold of you, and how do we get connected to these types of services at the Jesse Brown VA?
Yes. So one way that they can get connected is by calling the MST coordination phone line. And so that is 312-569-6784, or MSTI are those last 4 digits. And so they can call that number and leave a message to request a callback or request information. And I receive those messages directly, and I get back to people. And that is a top priority, to make sure that people who are reaching out for information get a response promptly, and their concerns are addressed.
Now, you touched on a topic, this is something that comes up a lot with military benefits, and that's entitlement and eligibility. So is there, is that a factor in trying to get help?
It is, but I think it is in a good way, because there's actually been legislation
But first
passed.
back us up and explain what that is, so people kind of get an idea. Because some people may have never tried to get any access to the VA, because they already feel like there's a brick wall there. So.
Right. And so eligibility for the VA often requires veteran status, active duty time served, 24 consecutive months of service. But when it comes to receiving and accessing care for military sexual trauma, these are individuals who often can access care or have increased eligibility, such that even if they don't qualify for full medical benefits enrollment, they can access MST-related care, military sexual trauma-related care, and get care for that, even if they're not eligible for full medical benefit enrollment.
So you don't have
to. And so that would include.
You don't have to have insurance or anything like that, or be covered by any kind of medical plan.
They do not need that. And in particular as well, when it comes to military special trauma related care, there would be no copay for those services because U.S. code and law has ensured that those services can be received free of charge.
Wow, that's really good. That's good to hear. Something that's a silver lining in the topic. But what are the levels of care at the Jesse Brown VA? So what is that process like?
Yeah, and so we were talking earlier about how MST is something that is an experience rather than a particular diagnosis. So one of the first things that might occur is getting a sense for what kinds of concerns or issues might be coming up for that person. And so that might be, relationship challenges, depression, anxiety, substance use. Maybe it's post-traumatic stress disorder symptoms. It could also be physical health issues like chronic migraine headaches. And so depending upon what types of these concerns are coming up for the person, we certainly have outpatient medical care that can help address those medical concerns. We have outpatient mental health services. We have the Beyond MST app, which is available on Android and iPhone platforms. You can download that, at your home and at your convenience and access that educational resources and tools, anytime you want. But outpatient mental health services, I have extraordinary colleagues who are waiting to, really provide care and assistance. But for some individuals, they might also need residential treatment or intensive outpatient treatment, which can also be available. I also like to just make note of the Veterans Crisis Line as well, which is a 24-hour resource that anyone can call if they're in a crisis or they're needing additional support. And I can provide that number, which is 1-800-273-8255.
So walk me through the process. So a person calls up to get help, and then so what's the first step, and what can they expect when they go through the process of trying to get recovery or get help or treatment?
Sure. And so I think one question is about that is whether they're already enrolled in VA healthcare, and if they are, then they can talk to their existing providers and request a referral, or they can call my MST coordination line directly to get connected. But if somebody isn't enrolled in VA care already, they would likely be just coming down to Jesse Brown and presenting to the eligibility and enrollment front desk with your DD-214 and a picture ID. And with those resources, we can get the enrollment process started, or the getting in the system, if you will. And from that, individuals can do a same-day mental health intake through the psychiatric assessment clinic. Fantastic colleagues down there that are just really willing to do an initial intake assessment and get a better sense for what kind of services and resources might be helpful for that individual.
So you touched on this a little bit, but I want to get more details. So say a person who has never treated their event, I guess we call it. So, and they have what types of symptoms and how does it manifest themselves in their lives, and how can they make the connection to say, maybe I need to talk to somebody about my situation? What are the signs that other people might be able to notice in a person's behavior that something might not be right?
Well, I think that, like we were saying, that can kind of vary for each individual. But some things that people might report experiencing could be having unwanted memories of the event coming to their mind. So if they find themselves kind of having a free moment while riding the L, or before they're going to bed at night and having kind of memories of the event coming to their mind, those can be intrusion symptoms is what we call those. People can also find themselves avoiding things that are reminders. So if the assault happened or if the incident occurred if there was a certain color or if there was a certain sound or stimulus at that time, they might avoid things that are reminders of that.
And do people still feel stigmatized by trying to admit it, particularly with men? Is that still a common theme?
Yes, I think it can be. But I think that one of the reasons that I appreciate being here today is to really increase people's education and let people know, that there's nothing to be ashamed of when it comes to having this type of experience, that it is something that others have experienced, and we want people to feel safe coming forward, and knowing that, the VA's theme this year is we believe you and we believe in you. And I think that's a good, succinct way of really saying how we want to support our veterans when it comes to this issue.
I think that's really powerful, especially in light, because that was education for me to learn that when I thought of military sexual trauma, I thought of it as a diagnosis. I didn't think of it as something that happened. So now it makes more sense, how people can struggle with it. And then still also, so along those lines, when you're with your experience and also with all the stories you've heard, what do you think needs to change in military culture in order to address this and do a better job of reducing these instances and these events?
Yes, good question. And I, recently, earlier this week, was listening to a presentation kind of talking about some of the changes that have been in place. And so there's, recent legislation and policies that are being implemented that help make it so that service members have options for reporting these kinds of incidents outside their chain of command. So they have more discretion, privacy, and safety in being able to report these kinds of incidents at the time of service, when it occurs. And they also have options for making restricted and unrestricted reporting options. So somebody can come forward anonymously, or they can, present with their identity being known. And then there can be different options for how kind of proceedings would go on from there. So, but I think that option, more safe reporting options is really a huge step moving forward.
Okay. So are the numbers in the military as far as events that people have, men and women, is it higher or about the same as it's the civilian population?
That's a good question, and I can't speak to those statistics, offhand.
From what I understand, they're a little bit. For women, it's about the same, but for men, it's a little bit higher. From what I understand, I'm not sure if that's 100% correct still, because I don't, keep up with the data. But the reason why I asked that question is because it seems like oftentimes in military culture, in our culture, we tend to address the thing after the event happens, as opposed to getting ahead of it to try to change the culture or change the ideology of why are people being assaulted at this rate, alarming rate, whether it's in the civilian world or the military world, veterans or civilians, either way. What's the mentality of someone or a culture that says this is acceptable or this is something that promotes this type of event?
I think that some of the elements that we commonly think of as being related to sexual assault are themes of power and control. And we know that the military is a place where the power structure and sort of command structure is something that can make issues of power and control complicated, and can sometimes have individuals feel like they need to confer certain respect to individuals or follow orders. And might be afraid to sort of diverge from that command structure. But I think that these options for reporting these events outside of one's chain of command empower the survivor and give them options that maybe weren't previously available.
I think it is a good step in the right direction. I would like to see more things happen on the front end. If we can get more into, trying to stop some of these things from before it becomes an event. So now, like I said, that's a game changer for me, because now I'm thinking of this as not a diagnosis. I'm thinking of a person having trauma like they're having ghosts in their mind, but really it's about the event that happened. So now I relate it more. So now I see military sexual trauma as more of a violence act versus some type of psychological, thing going on inside your mind. Give us once again, how do people connect with you or connect with Jesse Brown VA in order to get help? What are the first steps they need to do in order to reach out and try to get some of these things addressed?
Sure. And so, getting enrolled in VA care can be a great first step. But if that's sort of complicated or issues, I'm always here as a resource as the MST coordinator to help with navigate eligibility issues and enrollment. So just feel free to give a call to 312-569-6784, 312-569-MSTI, and we can help address the questions and get people connected.
Are there any text options? So say when someone would just text a message or get information that way?
No text messages. So currently it's just phone is the primary option we have.
There's nothing online
No, not. I mean, the Beyond MST app is a great resource for just getting education and information.
Okay.
So I think, that's a good tool if people aren't quite ready to give a phone call.
I appreciate your time. It was really informational and also very informative and very empowering to know that we can get ahead of this. I appreciate your time, Doctor. Welcome back.
Yeah. Thank you very much. I appreciate it.
All right.